I think really the first question I have is, clearly it's been a long time, and thank you for doing the work you do at the health department in Nash County. I mean, you've done a yeoman's job. You have pulled together and created great services from our EMT response team to, I mean, you manage so many things that folks don't even fully appreciate the magnitude of the job. And having worked in healthcare in the area, I just fully appreciate all that you do, even beyond providing, communicable disease reports and managing that process for the county, which has grown. I mean, we're 100,000 people plus now in Nash County. And gosh, what was the population when you started?
Well, it was probably 80,000, 75,000.
Okay.
And we have certainly grown 25% maybe.
Yeah.
And Mr. Mayor, I appreciate those comments, and being a person of professional in healthcare, it really does mean a lot to us. And we are comprehensive. We are still running a health department.
You are.
We're still doing prenatal care like tonight.
That's
Tuesday
right.
night in the office, we're providing prenatal care. And we run two different offices. We run one right close to where you're located,
Right.
downtown Rocky Mount, and one in Nashville. And we still have all those services such as prenatal care, STDs are still, they hadn't gone away a bit
Right.
with this pandemic.
I would think they'd be increasing actually, to some level.
They have to a large degree. Infectious diseases, even tuberculosis is still out there. And of course, we've got a pretty strong immunization with our pediatric clinics going on, and family planning has always been a big, big clinic. But COVID has certainly taken a lot of the priority of what we do every day. I mean, we've got separate COVID team that obviously we have to keep a group that just runs the regular clinics, health department clinics. But then we've got a special COVID team that really does just do COVID.
Right. And I want to hear about those, but I will say this. I was talking to a friend of mine just a couple of days ago, and I said, has anybody gotten anything other than COVID since COVID came out? A little tongue-in-cheek, because there's been so much focus on it, and for good reason.
Well, yeah, we did say that bad colds, just regular bad colds, didn't take a vacation.
No, right. That's absolutely right.
But you better not sneeze or cough around somebody, they're going to run.
That's right. Yeah. So what are the numbers? I'm sure the infection rate's increasing in the county now. And so just kind of give us an update where we are and where you think the peaks will be, and, the normal numbers.
I think that's a really good question. I just did a teleconference just about 30 minutes ago, and to go back just a couple of weeks. Well, let me go back to mid-September.
Sure.
We thought on September 14th, 490 new cases that week was really peaking. It was a peak for that particular time frame. And then we started going down with Delta, and then we saw another peak with this Omicron coming along. And week before last, and I am fast forwarding here, but week before last, I said, oh no, 373 new cases. That's up from 100 2 weeks ago, 200 and some the week before that, now 373. Then last week, I reported 1,425 new cases. I said, my goodness, over 1,000, nearly 1,500 new cases in the past week. And today, I reported 2,442 new cases.
Holy
I couldn't believe,
cow.
1,000 more new cases than the 1,425 I reported last week.
Holy cow.
Hospitalizations at probably an all-time high for the census with coronavirus-related patients at 52 patients in the hospital. But the good note on that, only 2 are in ICU. So we're not seeing still the severity with Omicron, but the transmissibility of it is really, really tough.
Right. So I've heard some people speculate out there that we might actually get to a herd immunity because it's so infectious, but I don't know. It's a speculation, kind of maybe call it cocktail talk. What are you hearing about that? Is there any hope that could be true?
I think it is some strong hope. I think there's some evidence there that with this spike, and it is a vertical spike, it's not even one of those, gradual inclines. It's a vertical spike we're seeing for the last couple of weeks in the nation, in the state, and right here in Nash County. And I can't help but believe, and from listening and reading national healthcare experts, looks like we may reach this peak sooner than what we saw with the Delta strain.
Right.
And I think we'll come down faster.
Okay.
And, with your part about natural immunity, we have to be building a lot of natural immunity with these new cases that we're seeing. So hopefully with those vaccinated that haven't contracted the virus and those that didn't get vaccinated but have had the virus, maybe we'll build up something close to a herd immunity. Now, the question, we used to talk about herd immunity way back when I was in School of Public Health, and we'd say, 60, 65% maybe herd immunity or 70. I don't know. That could be now 80, 85%.
Right. I was going to ask
kind
you
of a
what
moving target.
I was going to ask you what that percentage needed to be because,
Yeah.
I mean, that's it's a big deal. I mean, that's a large number. And, what I keep hearing over and over and over, and I'm sure is holding true in Nash County, is that of the vaccinated rate population receiving it, it's just not, it's been presenting really as a bad cold. For the unvaccinated, though, they've created a lot of hospitalizations, and even those in ICU have typically been unvaccinated. What is our unvaccinated population in Nash County and the area currently? Do you have an idea?
Yeah, we're about 65.
Okay, so we're about national state averages.
It could be, well, let's go to, that's more in the first dose. We're probably about 62 fully vaccinated.
Right.
I'm proud of Nash County's governmental staff of
Right.
the 600, 800, counting full-time, part-time. We did just get above 70% in the last week or two.
Outstanding.
And I think that was largely because our commissioners that incentivized a
Right.
program that made it a tad bit more of an incentive to get fully
lucrative.
vaccinated.
We'll call
that's
it.
it. That's right. Lucrative is a good word. That's right. But not that I think that you should be incentivized. It should come naturally. But I really do think that was one of the examples of where that paid off. It took us from the 45 to 48%. And then 55, then 60, and then a lot of peer pressure
Right.
on those because there was another little bump incentive if you got the second shot and got above 70%. If it stayed below 70%, one. So there was a lot of peer pressure to get it above 70%.
Right. So what are you seeing? I mean, you're anticipating that we'll see a vertical drop in that. I mean, when do you estimate the peak, or what are you hearing, or what are you projecting? I mean, I know you guys, it's an imprecise science, but what's the general thought or feel?
Yeah, I think the general thought is it could come as soon as a couple of weeks.
Right.
I'm really in hopes that today's report was the highest new case number over a week than what we will see.
Mm-hmm.
I hope we've reached that summit. I hope maybe we will level off, start to go down next week's report, but I wouldn't be surprised if we don't have one more week of a pretty strong number of new cases. And then I think we will certainly, as we get towards the end of January, 1st of February, start to see this really go down. And I think it'll go down pretty rapidly.
Well, I hope so. I'm certainly pulling for that. But with that said, CDC has changed their guidelines for testing, for when you go to work, when you present symptoms, and the symptoms are different. Do you mind kind of going over that with us? I've read it enough to be socially engaged with it, but certainly not enough to report it verbatim.
I think a couple of important things to start off with when you start to talk about the new CDC guidance for isolation and quarantine is to stop right there, pause, and define isolation and quarantine. Those terms are used interchangeably, but quite frankly, they mean different things. Isolation, if you think about isolation, it connotes illness.
Right.
So the person that is ill is in isolation, where the person that's been exposed is being quarantined.
Right.
And that's pretty much the scientific and legal definition of isolation and quarantine. Having said that, it has been a reduction in the 10 days, 7 days, and now 5 days, a reduction to when you contracted, whether it's a positive or symptoms first, or your test is positive, to stay isolated for 5 days and then go out with a mask and take some precautions, like those old 3 Ws we talked about early on with the ancestral strains, but to at least the 5-day strain. And the theory behind this is that this particular contagious nature of the corona strain is probably most contagious a day or two before the onset of the symptoms, maybe in that prodrome stage, and then just a day or two afterwards. So certainly as you get towards as you start the 0 day and go towards the 5th day, you should be getting out of that contagious stage. And I think that's what the CDC certainly based it on.
Sure.
So reducing it to 5 days. Now, the typical question is, you've been exposed.
Right.
How many of those have I had in the last week and over the weekend? And certainly, what kind of exposure is it, is the first question. Has it been a really close, within 6 feet exposure, and has it been more than 15 minutes, even if you had 5 minutes, 5 minutes, 5 minutes over a 24-hour period of time? So
it's a cumulative 15 minutes.
It is a cumulative 15 minutes, and let's assume it is a household pretty close exposure. It's an exposure, and of a positive case. And this scenario plays out every day, and I had that very call from a prominent citizen this past weekend. Daughter came home positive, lives in the household. My next very important question and answer is, have you been fully vaccinated and boosted? And he had, and his wife had. And so if you answer that question, yes, I have been fully vaccinated and boosted longer than the 10 to 14 day period when it really starts to work and becomes an optimal protection for you. That person can go to work. That person can go to work with a mask and just without symptoms, assuming they're asymptomatic, but they've been exposed, but they've been fully vaccinated and boosted, they can get out and go to work. I would add, though, they need to be very cautious. They need to make sure they wear that tight-fitting mask and really monitor themselves for symptoms, because if they develop symptoms, they really do need to be tested. And even if they don't develop symptoms, around the 5th day is the optimal day to be tested from their exposure period. It's too soon the first day or two. That's a natural knee-jerk reaction with people. Let me go get tested today. I just yesterday got this really, really close exposure. But 5 days is really the most accurate testing date. And that's when we recommend to do that particular test. And of course, if they're negative on the 5th day, then we say, hey, not only did we say go to work because you're fully vaccinated and boosted, but this just really confirms that.
Sure.
Then you get into those different tests.
Right. So I was going to ask about that. So the rapid test with 85% accuracy or less, I don't know. I mean, you tell me. And then there's is it the PSR test? And then I think what we've seen is it takes 7 days for it to get back. So I can give somebody that test, and it's so backed up, though, that they've completed the 5 day period before they even get the test.
Yeah, let's talk about those two tests.
Yeah, let's do.
That rapid antigen test, what is typically called, it takes about 15 minutes generally. There's some take-home kits that you can buy. We actually have take-home kits to give folks. And then we are out of rapid test kits right now, have been since Thursday, a week ago. But the rapid test is good for positives.
Right.
If it comes back positive,
you're positive.
It's pretty much, you're positive. But they do give some false negatives sometimes for a couple of reasons. It's just not quite as sensitive as that PCR lab test that we were talking about. One, if it's taken too soon, and two, if it is not a deep enough swab, and I'd have to say three, a symptomatic person gives a more accurate test sometimes with the rapid antigen. So if they're symptomatic, they've waited 5 days, we do get some fairly accurate kinds of readings. Now, a person typically comes into our testing clinic and they are symptomatic. And they even tell us, hey, I know I was exposed, and I can tell you who it was, okay?
And I don't feel so good.
And I don't feel so good at all. Might even had a fever, all those bad telltale signs. We test them and they're negative. We said, don't leave yet. Don't leave yet. Let's go behind that with a PCR.
Right.
Now, our PCRs that we have done go to the state lab, and I usually can get a reading back in 48 hours.
Okay.
That's still a long time. I have heard this 5 and 6 or 7 days.
Mako is the company that we had used as a contractor. But anyway.
I would like to give a plug to the hospital, to our own Nash UNC hospital, and Lee Isley, Dr. Isley,
Sure.
for coming to the plate with us last week when he saw us on saw me on WRAL TV talking about the surge and talking about the shortage of test kits. As a matter of fact, we, like a number of other health departments, were out of test kits. He donated.
Oh, fantastic.
I think he said 500. Our first shipment was 400 test kits. Not only did he donate them, but they're PCR. They're the best molecular type of test, the gold standard we refer to in testing. And secondly, guess where the tests are done? Right there at the hospital lab.
Oh.
So the tests we did that the first time yesterday, used hospital test kits, PCR gold standard test kits out in our parking lot, did 98 tests, and had a runner to go over, and not literally, but a person to take it to the hospital. And within 4 or 5 hours, by 9 o'clock last night, we were starting to see them roll in the test results. As a matter of fact, I got a couple of telephone calls still at the office at 9 and 9:30 last night with some good ones and some, unfortunately, not so good.
Sure.
But that was a big advantage to us. And I really, again, would like to toot the horn of UNC Nash for providing that to us. And as a matter of fact, I hope we can establish a relationship of that kind of thing that with the lab that would afford us to be able to do that the sooner. Because not only did we get lab test kits that we didn't have, they were PCR, the best you can get, and we got a quick turnaround on the results.
Well, the hospital has been a great community neighbor for a long, long, long time, and a great corporate citizen. One of the things you were talking about a little bit earlier that I think maybe folks don't really fully appreciate, you started talking about wearing a tight mask. You're really talking about an N95 or a KN95. You're talking about something that's form-fitted. And, and what's different is perhaps the general belief that these cloth masks they're really not very effective. And so you might want to talk a little bit about that, because I'm not sure everybody fully understands the significance of that, but that's a big deal.
It is. I tried wearing, and I've done this before, but I wore one N95 out last weekend. And it is a little tougher to breathe, but hey, what does that tell you? It's tougher to get particles in there too. I'm going to give you a pretty good analogy that I read, and it was really a science-related magazine talking about COVID-19. But it said, think about a mask this way, the cloth mask, or even the thin lead surgical mask. Think about it like a chain link fence. If you were hitting golf balls into that chain link fence, and let's call the golf balls particles, virus particles.
Okay.
X number would go through the chain link fence.
Eventually, for sure.
If you hit direct with these chain link fence, but if you put 2 and 3 fences together, and especially if you moved them a little bit, it's a good chance very few or none of the golf balls would get through. And I think that's kind of analogous to the mask situation, whether you wear 2 masks or one real good one, or it's just real well-fitting, that it does block X amount of particles that would come in. Maybe not golf balls, but particles.
Understood. Well, golf balls, maybe it blocks those too, but it doesn't soften the impact.
That's right. That's right. So I think the mask is still extremely important. I think we still see a lot of compliance with that in different places, and then we see a lot that are not compliant. But I think it's still important. I think the 3 Ws, I like the distance factor still.
Sure.
I like it. I like the mask, and I've always liked washing hands, whether it's just for bad colds or just for sanitation reasons.
I've always believed in washing hands too, but nothing has incentivized me more than COVID.
Yeah.
So I have done a diligent job for at least a year and a half, 2 years now. And not that I didn't before, but I am extra cautious now.
I'm not, I wouldn't be surprised that this whole generation, maybe growing up in the pandemic and living in the pandemic, that might be a good habit that's been formed from this particular one of the 3 Ws.
Absolutely. Yeah. So let's talk about screening a little bit. So, this version or this strand of the virus is not presenting necessarily the same way. Before you were going in, people were taking your temperature, people looking at you, making you go through a questionnaire. I'm not seeing that anymore. Not a lot of people are presenting with fever necessarily. So what are you looking for? What is What is showing an active case look like? Because that's just different for everybody, but I think that's important to frame as well.
Well, the person hasn't seemed to be quite as sick. Taste sometimes has not been as altered. That was one
Yeah,
of
that was a
those
big sign.
early telltales.
Yeah,
Smell and taste, and I would get that all the time with Delta.
right.
You'd get that, oh yeah, it's completely gone, or so distorted, something that normally had a nice aroma did not smell good at all. But I haven't noticed that coming back quite as much, being an issue. But also just the severity, I think, of Omicron has mimicked just the typical, let's call it coronavirus cold. Coronavirus colds have been around for a long time.
That is a common cold, right?
It is common cold. And, that's what we've accepted as endemic in a population. And eventually, I think this coronavirus thing, this COVID-19 rather,
Right.
will become somewhat endemic, meaning that it's something we live with, meaning like there are countries that still have malaria,
Sure.
but they work around it the best they can, whether
Right.
they're nets they sleep in or other kinds of protective.
Sure. Or even the flu.
Or even the flu. That's right. What do we do for flu every year? We try to take some shots for it, or at least.
And we hope we get it right or get it close enough.
It right. And one thing about the flu last year, with COVID-19 and with the 3 Ws, flu just about disappeared last year.
Right.
And we'll wait and see what this year's going to be. But so far, it's been fairly mild.
Well, we did all the right things to protect ourselves from COVID, which we are also the right things to protect yourself from flu outbreaks as well, right?
Exactly.
You washed your hands, you wore a lot of masks,
Right.
you weren't as in close a contact. All the things you're supposed to do. And so
Exactly.
it was hopefully that holds true this year as well.
I hope so. It would be a nice sort of silver lining to come out of the.
There you go. There you go.
Because X number of folks really did get real sick, hospitalized, and unfortunately died from flu. Thousands a year in the United States.
I was going to say, I think the last number I saw, and I'm working off the top of my head, I may be wrong, but 30,000. It's just a fairly significant population every year.
That's right.
And we don't really talk about it, but that's a big number.
Yeah. And those folks that are high risk with COVID-19, we all know them. And certainly not to blame the victim here, but I think the unvaccinated population.
Sure.
And with this one, I don't think we can emphasize enough, not just being, because this definition is going to change what is fully vaccinated, what that used to mean, 2 shots. I think you're going to start to see, and I heard it today in a statewide conference call, start to change that to include the booster. But right now, let's call it the 2 shots and the booster. There's a big difference. I read 2 or 3 weeks ago, if you have the disease, have the virus, you might have 21% protection.
Okay.
If you have 2 shots, it might be 28% protection. But if you get that boosted on top of the 2 shots, it very well could be 85% protection.
That's a big move.
Says a lot for the booster.
Sure does. Sure does. So where can I get a shot? That's something I don't know that we've talked about today.
Come to us on Thursday.
Thursday.
Come see us. And I know this is
sure
tape, but typically we are having vaccination clinics every week. And this particular week, we've got a testing clinic tomorrow. We're going to do that at the Ag Center. We did one yesterday behind the health department. But our drive-through vaccination clinic will be this Thursday and probably the next Thursday and the next Thursday. We are seeing that wane a little bit, the interest in testing has gone way up and the vaccination's gone down a little bit, but we have about 65 or 70 on the appointment books for Thursday. And if you don't have an appointment, still come. We will not turn you around. If you want the first shot, second shot, or booster, we'll be ready to provide any of those.
Fantastic.
With Pfizer or with Moderna.
Look, I appreciate you coming and sharing with us where we are. Again, you're a great asset to our community, and thank you for all that you do.
Let me say, Mr. Mayor, I think you're a great asset to our city of Rocky Mount.
Well, thank you.